So to continue on about breastfeeding, what does a well-nourished breastfeeding infant look like? Well, one of the things to note is that infants typically have 6+ wet diapers a day. This is kind of dependent on the type of diapers that you use because there are some that are super absorbent, but meaning that breast milk is going through them. They have normal weight gain, that's probably the best way, and they have a stool a day. Most women will report a softening of their breast tissue after nursing because as that milk drains, it'll become a little softer. And it does take a couple of weeks, if not a couple of months, actually, to establish a good breastfeeding routine with an infant. Colostrum is the first milk that is produced, and it is a thick yellow fluid that's produced in late pregnancy and for the first few days after birth. It's very, very important for the infant because it contains many antibodies, and it also contains these components, these prebiotics. Okay, these are forms of bacteria that actually stimulate the gut bacteria, which in turn stimulates the immune system in the infant. And it provides that extra protection to the infant against infections. So what is breast milk made of? So when we look at the milk, there's two types of milk, the milk that comes out first and the milk that comes out second. But the thing I want you to note about this is that it's typically about 60% fat, okay, overall, and about 30% carbohydrate with very little protein. Breast milk does not have a lot of protein, but it's high in fat and carbohydrate. And so people have a hard time with that because we think protein's so amazing. But an infant doesn't have mature kidneys to handle that excess protein. So it's very important that an infant be fed with breast milk because of its high fat consumption, high fat component, and adequate carbohydrate for brain energy. So what does a mom need when she's breastfeeding? Well, what's interesting is that making a quart of breast milk requires between 800 and 1,000 calories a day. Okay, now we tell a mom when she's breastfeeding that she gets about 500 calories extra a day because she did lay down adequate fat storage during pregnancy, that she can use some of that fat storage to use the rest of this. And it is a great way for women to lose weight post-pregnancy. So what does mom need? Extra fluids and extra calories. So why don't so many people breastfeed? I think a lot of people have misinformation about it. And I think a lot of women, the need to return to the workforce isn't conducive to breastfeeding. Okay, that's all. I'm sorry that ended up being pretty short, and I appreciate your time, and we will get chapter 18 up next week. Thank you.